Greetings from Chandray. I'm Dr. Shruti Desai, rheumatology doctor from Chandray Hospital. In the recent times, a lot of people talk about allergy. A lot of people tell about they're having allergic symptoms to one or the other substances. But not many people know about its treatment options and what can be done to solve this problem. So to talk about this important topic, we have our consultant and allergy specialist, Dr. Smita Jayan Singh, who is going to give you more details about allergy and its management. So welcome, ma'am.
Hello, everyone. Greetings to one and all.
Ma'am, can you give us more details about what is an allergy?
Yeah, of course. Allergy is a hypersensitivity reaction which is mediated by various immunological mechanisms in our body. To make you understand in simple words, it is an abnormal reaction which is encountered by your body when it comes in contact with an allergen, either by inhalation, injection, or skin contact.
Right. So you mentioned about allergens. So what are the allergens?
These allergens are the particles which are responsible for causing allergy. They are minute particles which are made up of various proteins. These allergens can be categorized into various types. It can be categorized as food allergens, inhalant allergens, and insect products, as well as drugs. So to name a few common food allergens, it can be milk and milk products, which is responsible for allergy, nuts allergy, and seafood, especially fish and prawns, also do produce a lot of allergies. Apart from that, coming to inhalant allergens, there are various pollens in the atmosphere, the commonest one being parthenium and sunflower allergens, various flower allergens. These can be responsible for allergies. And apart from that, when you get an insect bite, it could be bees or wasp venom, which in turn produces allergy. And the insect products like cockroach calyx, house dust mite also are responsible for causing allergies. Apart from all these allergens, there are few drugs, like the commonest one being penicillin. This antibiotic is used for various infections. So we hear of a lot of penicillin allergies as well. And apart from penicillin, the commonest ones are the painkillers. So when you take a painkiller for headache or something, people end up with having rashes and itching. So these are the various categories of allergens which we come across commonly.
Right, ma'am. Okay. So if somebody is having an allergy, so what are the symptoms they naturally can have?
Yeah. Allergy is a multi-organ disease. It involves many organs like eyes, nose, throat, lungs, skin, etc. So when it comes to eyes, it can present in the form of redness, itching of eyes, watering of eyes, and a lot of irritation and discomfort in eyes. When it attacks the nose, you will have nasal block, repeated cold, recurrent sneezing, and so on. And when it trickles down further into your respiratory passage, there might be irritation of the palate, itchy palate, repeated sore throat, itching of throat, throat pain, and further down in the respiratory system, when it comes to lungs, it can cause spasmodic type of cough as well as wheezing. Now, when it presents, when it attacks the skin, it can present in the form of rashes and itching. Apart from these organs, when a person happens to eat some food outside, he can end up in having crampy abdominal pain with vomiting and loose motions. So this also could be a part of allergic presentation. And when a person is exposed to a specific environment, say when he has attended some field work or so on, he might land up with unusual presentations, and this could be also a part of allergic symptom. So these are the various presentations of allergy.
Right, ma'am. Okay. So when the patient comes to you, so how do you diagnose that the patient has an allergy?
When the patient walks into the clinic, first and foremost thing is we should take a detailed history as to how many days the person is having the symptoms from, and what was the triggering factor for his symptom. And apart from that, we do a general physical examination. And along with general physical examination, there might be few tests or investigations which will help us to diagnose allergy. They might be blood tests. In blood tests, we have CBC, that is complete blood count, in which we look for eosinophils and absolute eosinophil count, which could be increased in allergic patients. Apart from this, we have a test called as serum IgE level, which is done for allergies. The normal range is below 100, and if the range exceeds above 100, then we can raise a suspicion of allergy. And if the serum IgE levels is positive, we go ahead with one more test called as allergy panel. Apart from these usual tests which are required for allergy, sometimes the presentation of allergy can mimic other diseases as well. So to rule out other diseases, we do other tests called as ANA, that is anti-nuclear antibody test, and complement level C3, C4 levels, where we can rule out other autoimmune disorders as well. And when a person has chest symptoms like cough, chronic cough, wheezing, and so on, we might require a chest X-ray as well as a lung function test, which is called as PFT, the pulmonary function test. And apart from that, when there is a skin presentation and we cannot conclude with the help of blood tests and so on, still we have a doubt about diagnosis, we can go ahead with the skin biopsy, where you take the bit of a skin which is involved and we can subject it for testing so that we can conclude the diagnosis and treat the person aptly and accordingly.
Right, ma'am. Okay. So you mentioned about the allergy test in between. So what is this allergy test?
Yeah, this allergy test, it can be done in two ways. It can be, it is categorized into skin prick test as well as blood test. Coming to the skin prick test, the various allergens are injected on the forearm of the individual intradermally, and we wait for the response of the individual. It can be read in millimeters. Suppose if the reaction is seen above 3 millimeters, then the test is considered as positive. And coming to the blood test, the blood is drawn in the usual method, and in the blood, there is a food panel and inhalant panel where the different food allergens as well as inhalant allergens are checked in the blood. In case if the food allergens happens to be positive, then we would ask the patient to avoid that specific food for a particular period, say 1 to 2 years, and later a food challenge can be done. And if there is something positive in the inhalant panel, which could be the possible environmental trigger, then we go ahead with what is called as immunotherapy.
Right. So we've diagnosed a patient as having an allergy. So what are the treatment strategies available?
There are various modalities to treat a patient who has allergy. First and foremost, the first line of treatment is with antihistamines. The drugs, it can be oral as well as parenteral drugs, that is in the form of injections, as well as local applications. So coming to the oral drugs, they can be antihistamines, the commonest ones being the cetirizine, the loratadine, and the good old Avil as well. And apart from that, we give steroids in case of emergencies. And if the patient lands up in severe emergencies, then you might require injections. And there are few local applications which will help in soothing the skin rashes and itching as well. And along with this type of treatment, there can be few lifestyle modifications which will help to reduce allergies, and avoidance of allergen also would definitely help to reduce allergies. And apart from all these modalities, there is something called as immunotherapy, which will help in reducing allergies.
Right, ma'am. So the last word you mentioned is the immunotherapy.
Yeah.
So can you elaborate more on this immunotherapy treatment?
Yeah. Immunotherapy, it is basically a desensitization process. Whichever allergen the patient is sensitive to, with the same allergen, the patient is desensitized. So this is also of two types. It is called as skit therapy or slit therapy. The skit therapy means subcutaneous immunotherapy, where the allergens are injected in the form of injections. And the slit therapy, it is called as sublingual immunotherapy, where you prepare drops using the same allergen whichever the patient is allergic to, mixing it with glycerol solution. And these drops have to be used orally, that is below your tongue. You have to lift your tongue and put the drops. This type of treatment is called as immunotherapy. It has to be used for 2 to 3 years for good results, and it will definitely help in reducing allergies.
Right, ma'am. Okay, so that was a very detailed information about the allergy and the treatment options available. So can you give us any final message to our patients?
See, allergies can affect the overall population up to 30 to 50% at any given point of time. And it has various presentations, as I have explained to you. It can affect eyes, nose, throat, lungs, skin, so on and so forth. So with the tips, whatever I have spoken today in my talk, in case if you suspect that you are suffering from allergy, I would definitely advise, please do consult your allergy specialist and get treated yourself for allergies. Thank you, one and all.
Thank you very much, ma'am.